I would like to bring up right now Heather Back, who's the Executive Director of the Medicinet Health Foundation, and she's going to tell us exactly why we're here this evening. Heather.
Thanks, Steve. Notice I had to lower the microphone so you could hear me. Good evening, everyone. Welcome. I'm Heather Back. I'm the Executive Director of the Health Foundation, and thank you for joining us this evening. I want to begin by extending our gratitude to all of our donors, supporters, and healthcare professionals that join us in making an impact in local healthcare every day. Tonight is about having fun, getting connected or reconnected with our friends and our community. And firstly, I'd like to extend our thanks to Craig Elder and Nick Punko from RBC Dominion Securities Wealth Management for being our title sponsor for this lovely evening. Thank you. Before I begin introducing the hardworking team that Michelle's put together, I'd like to invite our board chair, Nick Punko, to the podium to say a few words.
Good evening, everyone. Not used to talking to a microphone. Thank you all very much for coming this evening. First, I'd like to just say thank you for everyone for attending, and a big round of applause to Heather and the team for putting this all together tonight. I also want to point out we have another board member with me, Grant Walker, up at the front. So say hi to Grant. Thanks for coming. So we had the chance this week to go to the hospital and actually do a tour, and I think it really reinforces for the board and for everyone the impact that the board and the foundation has in our local hospital and the community. And from our standpoint, this is really just a chance to say thank you on behalf of the board to the donors, and most importantly to the healthcare professionals who really give every single day to give us the best healthcare we can achieve. So with that, I want to say thank you very much on behalf of the board and wish you all a good evening.
Okay, now I gotta find my spot and fix my mic. So anyways, tonight is really all thanks to Michelle. Tonight when I was getting ready, I had to make a text to see what I could wear and what I couldn't wear. And my daughter said, I thought you were the boss. Nope, Michelle's the boss tonight. So Michelle, thank you for all your hard work, and thank you for your committee. There's a couple committee members, if you could stand or wave, or Maureen, and look at Jen, they're trying to pretend they're innocent. Who, us? Thank you so much for all your help in putting this together. Just want to quickly introduce the rest of the team. Sue Edwards is hiding by the auction. Valerie Verge is with Michelle, and Alexa's hiding over with the red hats over there. And a special thank you to all of our volunteers who are really the backbone of the Health Foundation. We couldn't do what we do without them. And they're all over here tonight at our craft table, inside at our booths. Thank you so much for all of their help. But also thank you to our photographer, Stephanie. I'm not sure if you've seen Stephanie. Stop Time Images, so stop and visit her. Darlene, if you haven't visited Darlene at Teaser Me, please stop by there. She's graciously donating tonight as well. Aurora in Fairy Magic Emporium. She's over here in our, I can't even say the word, and thank you. And Connie is our spiritual medium over in the tent. So they're all volunteering this evening, so thank you so much to all of them for their help. I just want to give you a few highlights about the Health Foundation and why we're here tonight. So we've been in operation for 26 years, and our main purpose is to enhance and encourage innovation for local healthcare. To date, we've raised, ready for this, $19.3 million for local healthcare. And I checked that this afternoon. That is as accurate as I can get it. We currently have three main priorities that I want to tell you a little bit about tonight. They are on the podium as well if you get a chance to read it. But our first priority right now is our Hannah surgical table. And some of you, if you're regular donors, would have got a letter in the mail asking to support the surgical table. So I'll tell you sort of the layman terms, and then I'll call upon Dr. Baring to tell you the more technical information. But basically, the Hannah surgical table is a specialized table that is designed to improve the outcomes of hip replacements. It allows the surgeon to do the hip surgery from the front instead of flipping the patient over. But it is an orthopedic table. It's good for knees. It's good for all kinds of orthopedic surgeries. And we have a new surgeon coming soon, and we don't want our doctors fighting over the single table that we have, so we thought we better get them another one so they play nice. So at this time, I'd like to introduce Dr. Michael Baring to tell us a bit more about the Hannah table from the professional perspective.
Well, thanks, Heather. Honestly, I don't have a whole lot to add, but you're right. The Hannah table is a radiolucent table, which basically means the x-rays that we use can go through it. It allows what's called a muscle sparing approach instead of a muscle cutting approach to do hip replacements. So the rehab for the patient is faster, they're up and better quicker, they're out of the hospital quicker. And she's right, there's currently 2 surgeons in our hospital that use it, and ironically, they operate often the same day, and so scheduling has been a bit of an issue. So if we get 2, that'll make the scheduling and the flow easier. And we have a 3rd starting in July. He's brand new out of fellowship. He'll be doing a similar operation. And we definitely need that second table to ensure that we can get people in and get people out and get them the care they need. So I really appreciate the Health Foundation on this. And as she stated, it's expanding into, you can use it for trauma. Because it's radiolucent, it has more levers and things that you can possibly imagine on how to work it. So I'm all glad you're here tonight to support us in getting the money together for our new table. We sincerely appreciate it, and thank you very much.
Thank you, Dr. Baring. Our second priority is kind of a new one. We haven't told many people about it, so you'll be the first that get to hear about it. It is I'm going to call it a cardiac central monitoring system. It's for our ICU department. And I'll invite Evan up to tell you more about it in a sec. But first, I want to tell you what I learned, what really surprised me. And it was the fact that our ICU department monitors every cardiac patient in the hospital. So if you're set up for telemetry and you're in the 4 West department, the ICU department is the ones watching your heart through the monitoring system. So this system isn't just going to affect ICU. Yes, it's stationed there, but it's affecting all the areas of healthcare related to cardiac. So at this time, I'd like to invite Evan Jans, the department manager of ICU, up to tell us a little bit more about it.
Yeah, how high does this mic actually go? Not that I don't talk loud enough without the mic anyway. So thank you for the introduction, Heather, and thank you for everyone who is here to support the foundation in our community. As already stated, my name is Evan. I'm the manager of the ICU here at the Medicine Hat Hospital, and I'll give you a bit of elaboration on this equipment here. So essentially, we are looking to replace 2 systems of patient monitoring within the hospital that are used in and around the ICU. The equipment we have, while it does work, is very old and in need of replacing. So if anything was to break on it, anything of significance, it would be difficult to find parts to repair or service it. And so instead of even having that conversation, the foundation kindly added us to their fundraiser list. And so here I am talking at all of you. The first of these 2 systems is the wireless heart monitoring system called telemetry, the one that Heather mentioned. It is used on Patient Care Unit 4 West. It is essentially just a continuous ECG or EKG. I'm sure everyone's heard that term at some point. And it lets us watch in real time and live all the heart tracings and heart monitoring that a patient has while they stay in the hospital, instead of just a single snapshot, the way a typical ECG works. And if anyone here has ever known someone who was admitted to the hospital for heart problems, they would have either been on Patient Care Unit 4 West using this very equipment, or in the ICU using the equipment that I'll talk about in a second here. And so the reason we monitor this, and we monitor this equipment from the ICU itself, is because if there is a problem with someone's heart, if there's an emergency, the ICU is the team that responds to this emergency. So we see these monitors, we monitor these systems within the ICU, and this allows us to see any emergency as it happens. And this gives us an advantage of time in a cardiac emergency, which is one of the greatest advantages that you can have. And I have seen these alarms ring, I have seen nurses and doctors run over to 4 West, and I have seen patients' lives get saved because of these systems and the way that they work. So when we look at these numbers, we provide continuous heart monitoring on up to 16 patients at any given time for 365 days of the year. That's 5,840 days of care every year that we're able to watch the hearts of people in this community. The second part of this equipment we use within the ICU is to monitor the ICU patients within the ICU exclusively. These are bedside monitors. They are complicated monitoring systems, and we have one in each of the 10 ICU rooms. They allow us to maintain very complex monitoring of a wide variety of patient systems. This includes continuous telemetry, continuous blood pressure monitoring, and pressures within your chest to help us watch your heart. It allows us to check your oxygen levels and carbon dioxide measurements as you breathe to keep an eye on your lungs. We can check the pressure inside your abdomen to make sure that after surgeries, we are avoiding unnecessary complications. And we can watch your core temperature as it fluctuates and changes to make sure that we are having effective treatments and therapies. And this is only a very, very brief, high-level overview of what this equipment can actually do. There are a wide variety of treatments and procedures that can be paired and tied in with these systems to provide data on patient care. And when we put all of this information together, it helps our ICU physicians, nurses, and respiratory therapists provide the best possible care and make the best decisions for the patients. And it's never a good thing when someone needs the ICU. Honestly, it's like the last possible place you ever want to have to be, or you ever want someone in your life to have to be, someone you care about. But the reality is that a lot of people need the ICU, and it's not going to be changing. A lot of people need it for a lot of different reasons. And so we are looking today to use this as an opportunity to continue providing the high quality care that we provide with the high quality equipment that we currently use and would like to continue using in the future. Thank you.
Now you can tell why I let him explain it better. So our third priority, and I'm not sure why I'm so passionate about this, but it continues to be mental health. And maybe it's because it's what our community is talking about. So in my opinion, there is so much more work to be done in mental health. We want to make sure that our patients that visit 5 North, our psychiatric unit, have a warm, welcoming space and a comfortable place to heal. We're hoping to replace all the beds in that unit. We want to fix the old, and I call them disgusting curtains that are in that unit, and provide them some color and even an additional television so that they can have some entertainment. So as you guess, this is where I ask you to consider making a donation, making a difference to local healthcare. You can do that tonight by joining our online auction. Whoops, Sue's got some technical issues. Buying a 50-50. Buying some wine beside the 50-50, giving it our tip taps that you may have seen, or just visiting one of the staff and making an outright donation. Any little bit helps. So thank you so much for joining us. And now I'm going to turn it back to Steve to pump you back up and get you back excited and playing some games.
That's wonderful. A lot of great information. Thank you, Heather. I have it on good authority that the online auction is up to about $8,700, so I'm sure we can get that over $10,000 tonight. And the 50-50 right now take home is about $240. You'll find that just inside the doors there. So I'll let you get back to the activities. Lots of games out there. Get on the croquet. I think I saw somebody beating the ground with a mallet, so there must be some pretty good games out there. But go have at it, have some drinks, and enjoy yourselves. Thank you.